later. Very good there. Where's that?
Pains in my right side. I've been having them for about 4 or 5 weeks now. And off and on for about 6 years.
What are they like?
Real sharp stabbing pains in my right side over here.
How often do you get them?
They come and go. Sometimes they come there. I have them 2 or 3 weeks at a time. And sometimes not. Sometimes it'll go away for 6 months. But then it always comes back.
When you say 2 or 3 weeks at a time, are they with you all the time?
Most of the time, yes.
Do the pains keep you awake at night? The month you've ever had them for this for about 2 weeks in a row, so.
Well, I've had them now for about 5 weeks.
Let me ask you a couple specific things about the pain if I can. Is it associated with nausea or vomiting at all?
Not so much vomiting, but I feel sick to my stomach. 2 weeks ago, I started getting pains lower in the lower part of my stomach.
On both sides or just one side?
Mostly just the right side.
How are your bowels moving in general?
Well, sometimes I'm constipated, sometimes I've got diarrhea, and sometimes I'm normal.
How about in the last couple of years?
Well, I haven't been very normal lately.
What's normal for you?
Well, every day, you know.
And in the last week or two?
I think I've only gone 3 or 4 times in the past 2 weeks.
Does it hurt you when you go?
Yes.
The same pains that you have otherwise? When you do go, does it relieve the pain?
Sometimes.
Many primary or family physicians will say that 50 to 80% of their patients suffer from symptoms which are primarily emotional in origin. Any conscientious physician, of course, will want to check out the possibility of organic illness.
With a clue of long-standing pain, such as this patient reports, and the physician very often sees in his practice, he will try to establish some links between the circumstances of her life and the complaint that she has come in with.
Do you remember when the first time you ever had the pain?
Well, I remember the first time the doctor told my mother that what it was when I was in the 10th grade. I had a bad attack of these pains when I was in physical ed.
Do you remember the details of
I
that?
almost passed out from it. The pain was so severe, but I went home, and the next day I went to the doctor. My mother took me to our family doctor, and he examined me and told my mother what was wrong. He told her that my appendix were infected, but it wasn't absolutely necessary at the time to have them taken out.
And you continued having the pain from 6 years ago, really up until the present time? The same
Off and
symptoms?
on, yes.
Let me review. Your appetite recently has been?
It's dropped recently.
Normally it's pretty good, isn't it?
Yeah.
How much do you weigh now?
198.
Was there any place that you gained a lot of weight, or have you always been?
Well, right after I got married, I started gaining a lot of weight.
What was that?
In 1966.
Have you been trying to lose weight? Have you been on the top of it?
Well, I've been trying to stick to a diet, but I haven't got that much willpower. Before I came to Boston, I was going to a doctor to lose weight. And I was losing weight fairly well before I left Miami. And I gained back about 15 pounds of it.
Did you ever get upset about being overweight?
No, it's never really bothered me that much until recently. But,
Or what's happened recently?
my boyfriend. But it hasn't really upset me. It just has me where I want to lose weight. In fact, I've lost about 4 pounds in the past month. It's not a great accomplishment, but...
But it is making you upset because you've been trying to lose weight.
No, not really.
So what's the situation at home now? You have one child.
Yes, just me and my daughter.
Your daughter. Are you separated?
My husband is in somewhere in the south. I don't even know where he is.
How long has this been for?
2 years.
Have you been able to get on by yourself at home?
I've been all right. I was living with my parents for a while.
Do they live in Boston?
No, they live in Miami.
You say you were feeling pretty good when you were down there, right? But you lost some weight then.
Yeah.
Why did you come back up here?
I came up here to get away from Florida. I've been there all my life. I wanted to get away from any problems down there.
And in general, do you think you're getting on pretty well?
Yeah, I'm doing all right.
Are you serious with this boyfriend? Are you planning to?
Marrying one of these days. As soon as I can get a divorce.
Okay. You say he wants you to lose some weight, is that?
He does.
Is that one of the reasons that you may have come to see me, to help you with this problem also?
No, mainly it's the pains in my
Mainly it's
side.
the pain. I think what I'd like to do is examine you completely and try to find out if we can find any further source for these pains. Okay?
The physical examination and appropriate studies for this patient fail to reveal an organic explanation for her complaint.
Although doctors treat these patients and treat them well, it's often with a frustrating feeling that they don't know exactly what it is that they're doing for the patient. And with a waiting room full of patients, listening time is at a premium.
Now, this is the doctor's dilemma. Where does he go from here? If he could get a kind of emotional biopsy of the patient, he might be able to tie in some of the underlying problems with her presenting complaint. The psychiatrist is specially trained in these techniques. Let's watch as a psychiatrist pursues some of these issues.
You mentioned a number of things that you've had trouble with: overweight, headache. Anything else really?
Not really.
Have these things been present in your life for the most part?
The overweight started when I was in the 8th grade. The headaches I have started having the past few years since I got married. And that's about all.
You think that the headaches were related to the marriage?
I don't know.